Professor Henry Ergas is a distinguished economist and a scholar. He writes for the Australian newspaper. Yesterday, in the light of what Graham has just said, he made some very important points that we should remember in quoting statistics about these cases. The age composition of the population is a very important factor. More than 80% of the fatalities around the world have occurred amongst people aged 70 and over. Those aged at least 80 account for half of all deaths, while comprising fewer than 15% of the cases. And the risk of death in those age groups and in others is materially increased by what they call comorbidities, that is, patients carrying other conditions, especially those associated with diseases of the respiratory system. Then, of course, fatalities are significantly higher, as Professor Ergas said, in countries where the very old make up a relatively large share of the population and they're already likely to be in poor health. 7% of Italy's population is aged 80 and older, compared with 3.9% of ours. Then there are other factors, as he said, which compound the differences between Australia and those countries Graham was talking about. Aged care homes, for example, where fatalities have been appallingly high in Italy, France and Spain, are relatively tightly regulated in Australia, notwithstanding the fact that we've had deaths here in aged care homes. Nonetheless, our health and safety levels are more than respectable by global standards. Then there's the question of vaccination rates against seasonal influenza, which are very high in this country, and that's important because, as Professor Ergas says, and I quote, it materially affects the respiratory health of vulnerable groups and highlights widespread voluntary compliance with health advice, unquote. Then he made the further point, Professor Ergas, that the average distance, and this is a key point, between homes in Australia is about twice that of the United States and nearly 4 times that of Europe. So with the social distancing restrictions that are now in place, our settlement patterns reduce social interaction and limit contagion. Now, no one is saying we can relax restrictions, but from the outset, we should have been targeting highly vulnerable groups, and we should have been tighter about our borders at the outset. But Professor Ergas made one further point, that in spite of all the alarmist talk, our hospital capacity has been expanded. And that capacity is being increased because there are restrictions in place which are curtailing the incidence of things that normally consume scarce hospital resources. That is, there are fewer drink drivers, therefore fewer accidents, fewer sporting injuries, fewer complications from elective surgery, which is now not taking place. And that led Professor Ergas to the conclusion, I quote, there is consequently little basis, at least in the data as it stands, for the incessant move to clamp downs that in some cases are absurdly draconian. He said, and I quote, as well as being unnecessary, heavy-handed measures may erode community support for the restrictions, undermining our high levels of voluntary compliance with Australians already making extraordinary sacrifices. This, he said, is a time for prudence, not panic. I think the views of Professor Ergas deserve respect, and of course, above all else, we do need an exit strategy.